I'm Selena Campbell, frequent host of the Fertility podcast. This is Infertility. Before we dive in today, we just want to remind you to subscribe to our channel. We're posting videos featuring fertility experts weekly, and by subscribing and liking these videos, you'll actually be helping others find them. Last week, we posted a video overview on ICSI, Intracytoplasmic Sperm injection, which is a fertilization technique in IVF where a single sperm is injected into a single egg in order to fertilize the egg. This technique has been game-changing for those with male factor infertility and has been even more used broadly across many different patient cases in IVF. That being said, most clinics use ICSI a lot, but some other clinics don't use ICSI as much, so we asked Dr. Samuel Brown from Brown Fertility to help us understand this divide.
Every fertility center is a little different when it comes to their process scientifically in the laboratory. Some laboratory directors enjoy ICSI in all of their patients just to have more fertilization, more embryo production for the couples to basically save money. So hopefully they don't have to go through multiple treatment cycles in the future. Other fertility centers are a little more cautious, a little more conservative, where less manipulation is usually a very good scientific paradigm to follow. And if it's not necessary, then we're trained to not do it. So there is a divide. But again, recent reports show that about 80-90% in the United States at least, 80 to 90% of fertility centers will do ICSI across the board in all patients. And that's been rapidly changing over the past 10 years, where it was less than 50% probably 10 years ago.
Now, if some clinics recommend ICSI to many patients and other clinics recommend natural fertilization to many patients, then how do patients decide if they want to go forward with ICSI? Well, it requires a conversation with your doctor. Ask them why their recommendation is right for you. IVF is personalized, and each clinic has their own best practices. This conversation about ICSI has led to some interesting questions from patients over the years. Like this one: if IVF resulted in many eggs, would it be possible or appropriate to fertilize half of them using ICSI and the other half using natural fertilization?
We used to do ICSI split cycles in the past, and that was really to determine, is there a true sperm factor? Not just having a low sperm count, but intrinsically, will the individual sperm actually do the job or not? So to test that, they would take a woman's eggs, and let's say she had 10 eggs, and they would fertilize 10 eggs the standard way, where you put a certain concentration of sperm on the egg, versus half the eggs with ICSI. And it should overcome sperm binding problems, and it would help identify an intrinsic sperm factor in fertility by doing like a split cycle. It's almost like a test in itself. That's becoming a little dated. There's less of that occurring with conventional IVF.
ICSI comes with a lot of benefit, and if the clinic you're working with is encouraging you to use ICSI, it's likely because they believe that the benefit will help you achieve your goal. But that doesn't mean you shouldn't ask these questions. Talk to your physician. They are there to answer your questions. Thank you for watching this video. Don't forget to click the like button and subscribe, as that will help others find it. Also, if you want a ton more information about fertility treatments or anything else fertility related, we have it for you at progeny.com/education. And if you want to hear stories from people who have experienced these treatments, check out This is Infertility, wherever you get your podcasts. Thank you.